Welcome to the Confident Smile Podcast, where we talk with the leading experts on how to treat dental issues and get healthy gums and a beautiful smile. With your host, Dr. William Levine, a periodontist of 35 years and chief scientist at Periactive, a trailblazer in oral care. Periactive is clinically proven to reduce inflammation and promote gum healing within 60 days.
So I'd like to welcome our very, very special guest, Dr. Jason Kasarsky. He's in private practice for the practice of dentistry, high-quality dentistry, I may mention, in New York City on Madison Avenue. And I think what customizes, or where Dr. Kasarsky shines, is his ability to create the ideal smile based on the person's personal facial characteristics and customize that smile so the patient comes out with exactly what he wants. Dr. Kasarsky is an educator in the SPEAR program, which is a very esteemed dental continuing education group, as well as the contributor to multiple books about successful dentistry that have already been published. So Dr. Kasarsky, thank you for making the time. I know you have a very busy schedule, and I'd really like to focus on your specialty, which is how do we create that ideal smile so that the patient is happy with what they come out with and has that smile for life. So let's start off by a very, very simple question. That patient walks into your office and says, you know what, Dr. Kasarsky, I'm not happy with my smile. I'm missing something. What do you do? And now the ball is in your court.
First, thank you very much for inviting me for this podcast. And I appreciate all of the nice words you've said about me. Someone comes in, says, I'd like to change my smile or look at my smile. What can you do? So immediately I'm sizing up the theater. This is how I look at it. Your lips are like the curtain. The teeth are the players. There's the stage. Is there stage right, stage left? Is there too much tooth showing? Is there too little tooth showing? Is there not enough lighting? Are the teeth too dark, too light? Are the spaces in the corner of the mouth very dark and triangular that could be filled in with a broader smile? So I look at it from that stage perspective. Beyond the teeth, I'm then looking at gum tissue. Is there not enough gum tissue showing? Is there too much gum tissue showing? Are those players, the teeth, getting very small because there's a half an inch of gum showing? All of that starts to factor into decisions about how can we handle this situation and give the patient exactly what they're looking for. I'm also asking the patient exactly what they're looking for. Many people will say, well, I'm going to leave that up to you. But I want to make sure that I can exceed expectations and fulfill what the patient is expecting. If their expectations are too great for what I'm given, we have to tone that down right from the beginning. I think one of the important factors in this is using the gum tissue display as a key factor. Are there black triangles in between teeth? Has bone loss occurred so that teeth now are moved and one's in front of another? All of these little pieces of information factor into a final forecast in my mind, and then we would move along taking appropriate x-rays, taking appropriate models, photographs, and then having a discussion with the patient about what they would see as their vision of an ideal smile.
Fantastic. Great perspective on using the theater and the stage. I like it very much. Maybe share with our listeners, okay, now you've modeled the smile, at least in your mind, and you've gotten the patient's cooperation and understanding, and you now have a target. what are the different techniques that you may use to reshape teeth or create that smile? So that way our listeners could know what's available to them.
Okay. So the spectrum would be gentle contouring, right, or recontouring of tooth structure, changing angles of enamel. Beyond that, we're into using composites or filling material. Many people would just know it as bonding, where we would be matching or completely changing the color of tooth structure, but we're using an additive material that's directly placed on top of a tooth or on part of a tooth and bonding it into place, shaping it, making sure the bite is good, making sure flossing and contouring is good so that gum tissue health still is key. After that, let's talk about veneers, where we're placing ceramic material, porcelain, on the front of the tooth. That's more conservative than a crown. Crown is now going 360 around the tooth. Now, part of the veneer possibility is a no prep veneer. If teeth are in good position, meaning flat, and the patient has good sized lips, and we can place veneers right on the tooth structure without even touching the tooth structure with a burr, that's the most conservative way to handle changing a smile. Not everybody fits into that category because many times teeth are rotated, and to get an appropriate arch form and the look that we like to achieve, we need to change some angles. So all of that factors into from the recontouring to composite material bonding, veneers, and then into full crowns. I'll also add that many times using orthodontics, clear retainers, or pardon me, clear action aligners. Many people have heard of Invisalign. There are many different types. Placing teeth in an appropriate position and then doing the recontouring, composites, veneers, or crowns is a fantastic way to look at it. And I believe around the world, many dentists kind of leave that out of the thought process. There are times where just placing teeth in an appropriate position and then whitening them with a little bit of contouring will do the trick. All of that then factors into the patient's vision. If we can do that, and the patient says, never really thought about moving my teeth. I'm 55 years old. Do we want to do that? Yes, because if it's okay with you, it's simple to do. It's very conservative. I really don't have to touch and cut much tooth structure to get to where we want to be to achieve a successful vision.
Nice, very nice. So just out of curiosity now, I think adult orthodontics has become much more accepted over the last 15, 20 years. And have you seen in your office more orthodontics being done and less massive tooth cutting?
No question. Absolutely no question.
Yeah.
Um, because more docs are talking about it. B, the public is becoming aware. You watch an NFL game and there's an Invisalign ad. All right, so that's helped docs get the message across because people are coming in, patients are coming in asking, "Tell me about Invisalign. Tell me about moving my teeth around." Where that may never have the conversation 10 years ago, 5 years ago. Um, Also, in an adult situation, we're no longer, it's most of the time, it's not necessary to put silver brackets on a tooth with wires. Using clear aligner therapy, clear plastic, does the trick spectacularly. We're using it for children as well these days. that may very well be part and parcel of an entire movement as children are getting older, and now we're using growth forces to move teeth to the appropriate position. But clear aligner therapy has jumped off the charts as far as utilization in an adult, and particularly in a children theater as well.
So, tell me how you factor in the gum disease or the bone loss that might be associated with a patient who's a bit older and has some periodontal disease into your treatment plan, and how would you work out that factor?
During the comprehensive exam, now anybody coming in for treatment, we still have to start at square one. In that comprehensive exam, we're taking a good look at the x-rays and clinical view of what does the tissue look like. Is it edematous? Is it bleeding? Has it receded? Is bone health there? Um, I had mentioned before black triangles. As the bone is lost, tissue moves, and now we have those black triangles between teeth, which obviously in a finished product we need to close them down so they're not seen in the view. But the critical part, we can do wonders aesthetically, but if it's not built on a good foundation, problems. It's fine for 6 months. It's fine for a year. 2 years down the road, we start seeing failure. So going through a periodontal exam, pocket charting, many times we'll see the periodontist first and then get somebody on rinse therapy. A periactive comes right into play here as far as uh, taking compromised tissue and making it healthy, workable tissue that can last and help achieve a successful finished product.
So let's now walk through. You shared with us a lot of information. We start with the periodontal exam. We evaluate all the different options that are available. We discuss it with the patient. We reach a concerted agreement as to where we're going. The patient's experience, how does that get scheduled into to his life, into your practice? Is it all done in once we've aligned the teeth and they're ready? Do you do it usually in one shot, or you do it over multiple visits? And can the patient see it developing?
If it comes to just adding composite and refining or recontouring, that can be done in one visit. Right? Many times with more complex cases, what we'll do is we're taking pictures, we're taking models. I'll then sit and design a smile using wax on top of the stone models. We'll then take a matrix of that finished product in wax and transfer that to the patient's mouth. We'll put Vaseline on the teeth, take some composite material that's not going to set, but we can go to different shades, seat the matrix, let it set, pull the matrix off, and that new smile will be seen by the patient. Here's the mirror, take some pictures, show your friends and family. The other nice key about that is I'll then remove half of it so they can see where we started and where we can finish. That is a superb point for the vision of the patient, where they can, because once you see the whole smile, you go, wow, that's fantastic. But seeing half gone, then you go, now I really get it. We've lengthened 2 millimeters. We've rotated 16 degrees. All of that factors into, I'm ready. Then there's a financial discussion. Then you'll need one visit to come in to get prepared, anesthetized, prepared, temporaries made, very much like the view that I just showed the patient. They leave for 2 weeks, come back placing all of the appropriate ceramics. Now, if we're
Very
doing
nice.
top and bottom, we're doing one arch at a time in my hands, in my practice. Too many variables doing top and bottom. I've done it a few times. It's worked well. It's a lot more pressure up here for me, but it worked when patients are coming from Europe or South America or different parts of the world, and they're only in New York for X amount of time. That's when we'll do both arches.
So, okay, now we've gotten that patient their perfect smile. They're thrilled. You're comfortable with the professional performance and the health. How do we maintain and keep that professional smile, that perfect smile?
Got it. In my practice, patients who've had, whether it's get 2 veneers or a mouthful of beautiful smile with veneers, crowns, even the composite, you've got to be at a professional hygiene visit and checkup minimum of 3 times a year. Most patients that we see quarterly, right? Someone's putting in a lot of time, effort, and finance. I don't want anything going south. Neither does the patient. What we have found is once a quarter works beautifully. Studies will show once a quarter, you stay ahead of issues. Part and parcel of that is good flossing, good brushing, the checkups, and once again, I'm back to periactive, as a rinse. We use it routinely. It works wonders. Patients like the taste. There's no problem with them, getting samples. I know we had some difficulties during the COVID times in Ukraine. There were some issues there as far as production, but we're ramped up now. I've been told, we've ordered. It's part of the process now is in the States. So the delivery of periactive to be works well. We ship it to patients who don't live here, right? We will also, patients will take 2 or 3 bottles at a time, and they use that over their quarter. That's what I like about it. No alcohol. It's been about the best rinse I have found. I could say it's not about. It is the best rinse I have found over my 35 years of practice.
Well, Dr. Kasarsky, thank you. Thank you, because I think patients got a deep insight into what concepts and what elegance, in a sense, and planning go into creating that right smile, customized for what the patient expects and what the patient needs. And I appreciate your expertise. I appreciate the explanation. And I thank you very much for participating with us. And I hope to have you on for more topics in the future. So thank you.
My pleasure, Doc.
Thank you for tuning in to another enlightening episode of the Confident Smile Podcast. Remember, your smile is your greatest asset, and taking care of your dental health is key to showcasing it with confidence. Stay tuned for more valuable insights, tips, and expert advice to help you achieve and maintain a healthy and beautiful smile. Until next time, keep smiling